Hey, what's up guys? Aaron Kupitz, personal trainer, functional aesthetics EC. So today we're going to be talking about how you can fix your knee pain by fixing your foot turnout or abduction of your foot. So this is a pretty common thing that you see. Quite a few people actually have this. You'll see, like if you watch people walking, if you watch people running, where your feet kind of turn out to the sides like that. So I'm going to show you some contributing factors that can cause your feet to turn out like that. And basically what it is caused by muscular imbalance. So you have weak muscles on one side and overactive muscles on the other side of the joint, which are causing this issue to happen. So in this video I'm going to show you a couple of steps you can take to help to release those overactive muscles and strengthen those weaker muscles so that over time you can correct that and help to prevent getting a medial knee injury from your knee coming to the inside, getting that medial joint line on your knee, get rid of that pain that you're having there if you're having that. If you're not having it, there's a good chance you will in the future if you don't correct this. So anyway, without further ado, we'll get into the video and I'll see you on the flip side. Alright, so one of the things that can be contributing to that abduction of your foot, or the foot turnout, is by having a tight or having a lack of dorsiflexion. So dorsiflexion is when you raise your foot up like this, right? So you see this little muscle on the front here, the anterior tibialis, brings it up, and inverts the foot, right? Now, when you're going down to a squat or something like that, if you have a lack of dorsiflexion, it's going to cause it can't go down any further this way, so to get down further, you have to rotate your foot out, like that. So, the muscle groups that oppose the anterior tibia, or that oppose the dorsiflexion of your ankle, or oppose the anterior tibialis's action, are your gastrocnemius in the back, so your big main muscle here, and then deep to that is the soleus muscle lying underneath the gastrocnemius. And that one is the main one that you want to stretch here. So we'll show you a couple things you can do to stretch that out. And then also, one other thing I want to point out is you also have your posterior tibialis. So your posterior tibialis, if the anterior tibialis brings your foot up like this, the posterior tibialis dorsiflexes it and everts it. So it kind of points it out to the side a little bit like that. So we also want to work on strengthening that muscle as well to help with that turnout. But before we get into that, just showing you some basic stretches you can do for your calves, stretch that out, and then we'll get in to the upper leg and some of the issues that might be going on there. Alright, so to help stretch out the gastrocnemius, you just do a basic calf stretch. So you go against the wall and you come down, basically push your heel into the ground, and keep on stepping backwards far enough until you get that sufficient stretch in your calf muscle, right? And then, you all know, the soleus stretch is with the knee bent. And the reason you do this is because the soleus does not cross both the knee and the ankle joint like the gastrocnemius. So the soleus only acts on the ankle and it attaches below. So in order to stretch it effectively, you want to get the knee out of the equation. So how do you do that? Well, you bend it. So that's how you stretch your soleus. Well, now, while stretching is good, if all we did was stretch, that would not, again, fix the problem. We also need to strengthen some of the muscles that might be weak. So in this case, in the lower leg, the posterior tibialis is often weak, and it lacks that ability to evert the foot as you're plantar flexing your foot. So I'm going to show you an exercise you can do to help strengthen that. So as we talked about, the posterior tibialis on the back of your leg here, deep to both the soleus and the gastrocnemius, helps to plantar flex and evert the foot. So what we want to do there to work that muscle is simply take a resistance band, put it around the ball of your foot, and go from a position of dorsiflexion and inversion, and then press it down to that position of plantar flexion and eversion. And you want to go for, since this is in your legs, and your legs are for carrying you around all day long, you want to go high reps. So 15 to 20 reps doing this exercise, and then gradually increasing the resistance as you become better at doing that exercise. All right, so moving from the lower leg, we're going to go up to the upper leg, show you some issues that you might be having there. So one of the issues you can have is a tight IT band. So if you are having that foot turnout and that medial knee displacement, over time, that IT band is going to get irritated. So while it's not the root cause of the problem, it is also a contributing factor because it's going to get irritated, then it's going to get tight to prevent further damage to that muscle. And so what we want to do is first use a little foam rolling to get that IT band loosened up a little bit. So if you haven't seen this before, to foam roll your IT band, you start just below the hip bone, and lay on your side, and you roll yourself nice and slow, maybe rocking back and forth. If you find a nice tender spot, stay there a little longer. And you're just going to go back and forth like so. Go all the way down to just above the knee joint, and if you want, you can actually foam roll towards the quadriceps a little bit too, because sometimes that can become tight as well. So you want to spend about 30 seconds to a minute on each side doing that. Do that about once a day. Okay, so then after you've done that, now you want to stretch it. So we've loosened it up, we've kind of broken up the fascia a little bit, made it more susceptible or responsive to static stretching, which I'm going to show you here in a minute. My bad. Actually, I'm going to go into the next muscle that's tight, and then I'll show you a combination stretch that will stretch both of those muscles, both the IT band and, as we're going to talk about here now, is your biceps femoris. So your hamstring, you have 3 different heads on your hamstring. So the most lateral head of the hamstring is the biceps femoris. And that, so basically lying right along the outside edge of your hamstring back here. So if this muscle here is tight, it's going to act kind of like as if your leg was a bow, right? And if you think of this as being a bowstring and your knee joint kind of being where the bow bends, well, if this side is tight, it's going to cause your knee to go to the middle, and it's also going to cause the leg to rotate outwards because it's not perfectly centered in the middle of your leg, it's off to the side. So if this gets tight, it's going to also cause the foot to rotate out when you're going down. So if you're going down in that squat and this is too tight, well, it can't go down any further, so now you're going to have to rotate your foot out to the side, which causing that abduction of the foot. So the stretch we're going to show you now is a combination stretch. You stretch both the IT band and the biceps femoris. So what you do is you put your left foot in front. If you're stretching your right leg, you put your left foot in front, cross the right foot behind, invert that foot so you're on the outside edge of your foot, and then you're going to go down and push the opposite hip out to the side. So your right hip's going to go out to the side, and you're going to go down and kind of try to touch that foot with both hands. And you'll feel a good stretch all the way down the side here and into the peroneals on the side of your leg. Now, if you want an even better stretch for the IT band, because that was more specific to the biceps femoris, then what you want to do, you want to be in the standing position. If you want a really good stretch for the IT band, you're going to step behind, maybe stagger your stance a little bit farther, step a little farther behind yourself, and then to reach up over the head. And that's actually going to stretch the whole thing. You even might stretch the obliques, a little bit of the bottom of the lats as well. And if you can find the top of a door frame or something to grab onto, that'll give you a nice good stretch all the way down the side of your body. If you want an even better stretch, again, invert that foot and stretch it again like that. So that's going to help stretch out your IT band as well as the whole side of your body. Okay, so now we've worked on stretching out the tight areas. But we also need to work on strengthening the areas that are weak, just like we did in the lower leg for the posterior tibialis. Now we want to go up to the upper leg and we want to work on those areas to help strengthen that as well. So if you, when it comes, and there's going to be two main muscles that we want to focus on strengthening here. So the first one is the gluteus medius. So it basically lies here on the side of your hip, and that helps to abduct the leg, right? And also contributes to a little bit of external rotation. And then you have the gluteus maximus, which helps to extend, but it also helps to externally rotate the leg. So if you are having that medial knee displacement going on, because this biceps femoris is too tight and your knee's coming to the inside, then what's going to happen is that your butt muscle is going to get stretched too much because its function is to externally rotate. So now you're internally rotating, right? And causing that. So you might think, okay, well, my biceps femoris is too tight and it's causing this external rotation. Why would I want to cause more external rotation? Well, because it's also causing that medial knee displacement, which is contributing to internal rotation excessively too much, which then over time causes the foot to overpronate. If you've seen any of my other videos, you're going to have overpronation of the foot because you have too much of this medial action going on. When you have overpronation of the foot, again, it results in that abduction of the foot because you're like, well, I'm not going over the middle of the foot, so might as well skip that entirely and just go over the side because it's easier to do that. So, few variations to strengthen your butt, but one of the best ways to do it is just laying on your side. So one of the best ways to do it is just laying on your side like this and bringing your legs straight up. And as this becomes easy, you can add resistance bands, you can add ankle weights, you can do it in standing, adding a resistance band like that, and exercising like that. You can also do a clamshell where you put your toes together, knees together, put a resistance band around here, and open up like that. And that helps the piriformis a little bit, but also the glute medius to help strengthen that action. And then, obviously, to help strengthen the butt, you can do hip bridges like this, or, and once that becomes pretty easy, you can do this for a minute non-stop, fairly easy. Then you want to start adding a bar, put it across, put some padding on there, and then you can put your back up on a bench, and then do hip bridges like that. That's going to help strengthen the gluteus maximus. One thing that I found, which is actually very excellent for strengthening your gluteus medius, is actually doing different martial arts kicks. So especially the side kick, and I'll show you that here in a minute. If you can control your side kick completely and not just whipping it up there real fast, but be able to hold it out there, kind of like Bruce Lee style, you know, hold it up there underneath the guy's chin. Excellent exercise for strengthening your glute medius as well as most of your butt muscle. So this is a great way to also work on your balance. You can help build up strength in the peroneals and your lower leg there. All those muscles have to work to stabilize yourself while you're standing on one leg. So, you know, I find that you center yourself, taking a deep breath, then bring up that knee, and then pivot your bottom foot out. So you're going out, slowly extend that leg outward. So you're holding yourself up like this. And then if you want it better, you actually rotate in while keeping your leg out. So if you rotate your torso around this way, it really gives you a good squeeze in the butt muscle. All right, guys, thanks. That's all I have for today on helping you fix that knee pain by fixing your foot abduction or foot turnout. So if you like the video, make sure you hit that like button. If you'd like to see more content like this, be sure to subscribe to my YouTube channel, Functional Aesthetics EC. So hit that button down there, the bottom corner. And if you think that anybody that you know, friends or family members who might benefit from this video, share the video with them so they can gain the benefits of this. And we'll see you all next time for more health and fitness related information. Thanks guys for watching. Talk to you all later.